Hello everyone. So there has been a lot of talk going around about loan forgiveness for healthcare providers in response to the COVID-19 crisis. So today I wanted to talk about the Student Loan Forgiveness for Frontline Health Workers Act, which was introduced by Congresswoman Carolyn Maloney yesterday, which was May 5th, 2020. I've read the bill proposal several times, so I wanted to talk about some key points and talk about my opinion on the bill. So first of all, the purpose of the bill is to provide student loan forgiveness for frontline health workers who are working in response to the COVID-19 crisis. The bill proposes federal student loan forgiveness and private loan repayment. And you can also be eligible for both if you have both federal and private loans, which many students do, especially graduate students. The forgiveness would include the principal, the interest, and any late fees that have been incurred by the applicant. And it also stated that consolidated loans may be eligible for repayment or forgiveness. It just depends. And it didn't state the exact criteria to decide if they would be eligible, but that is great to know that if you have consolidated your loans, you may still be able to get this forgiveness. The bill did not state any kind of monetary limits for forgiveness or repayment, but in an interview, Maloney said that there would be no cap, which is great for graduate students and medical students and those that have incurred a lot of debt in their healthcare education. Also, the bill proposal states that the income would not be taxable, so it would not be part of the gross income for the recipient of the forgiveness or repayment. Now let's talk about who is eligible for this forgiveness. There's several groups of people who are eligible. The first group is doctors, nurses, home health workers, mental health workers, basically anybody who is certified, licensed, or provides direct health care in response to COVID-19 or in relation to the COVID-19 crisis. So that could be a CRNA, LPN, RN, doctors in all levels of training, so interns, fellows, residents. It's great that they considered every healthcare professional who is providing care during the COVID-19 crisis. So that will include physical therapists, occupational therapists, respiratory therapists, really anybody who's providing service during this crisis. The second group of people who will be eligible are students enrolled in programs that are healthcare related who are providing a service during this COVID-19 crisis. So they didn't go super into detail on this, but I'm assuming that they mean nursing students, medical students, respiratory therapy students, anybody who's doing clinicals in a facility or a hospital that is responding to the COVID-19 crisis, because they are all at risk. I think it's really awesome that they put students into this category, because I feel like students aren't usually included in things like this, and it's so important, and their role can be so supportive during these things when everybody's overwhelmed and students are there in clinic to help. The third group of people are laboratory workers who are testing for COVID, who are developing tests, who are working around the clock to make sure that people are diagnosed correctly. This group is very important. I'm glad that they're on there. The next group is medical researchers who are working on prevention, treatment, study, vaccine, anything related to coronavirus or COVID-19. So those are people you don't often think about right away, but they are exposed to the virus and they are working very hard to help come up with a solution for the virus. So while frontline health workers that are taking care of patients are directly with the patients, these people are behind the scenes, often don't get the recognition they deserve, and they're working on what I would say is a bigger scale and looking at the bigger picture. Next, we have EMS, or emergency medical service workers. They are exposed to everything you could possibly imagine. I actually think they're one of the most at-risk populations because they're out there in the public without any screening or protective measures besides the PPE that they have themselves. My brother's actually an EMT and he has been transporting COVID-19 positive patients since this started. So this is a very at-risk group. Now that sums up the groups that qualify for the student loan forgiveness, but the bill does say that if you do not qualify under one of the things that is listed, and you are a healthcare worker and you are working in a place with a reasonable exposure level to COVID-19, you can still apply and describe your situation and still be considered for the loan forgiveness. There was also a line on the bill that stated that families of healthcare workers that have passed away related to COVID-19 can obtain the loan forgiveness for them. In a situation where I think this would be useful would be if parents had co-signed or had taken out the loans in their name for their daughter or son's schooling, and their daughter or son had passed away in relation to COVID-19, the parents could get the loan forgiveness so they wouldn't still be paying it at that point. Obviously, money's not going to be the first thing on their mind, and that's a horrible tragedy, but I think that's good that they had included that in there. There's no minimum time of service for these groups that are eligible for this forgiveness, so as long as they worked during the declared COVID-19 emergency, they are eligible, whether they worked for a week, a month, or a year. According to this bill, it said there is no time of service requirement to be eligible. So the way this will work if the bill gets approved, the application should be, according to the bill, available within 60 days days of the bill enactment. So you should be able to fill out the application and get that going. Then there will be a specially commissioned group that will go over all the applications and determine eligibility. They will determine eligibility of the candidate as well as the types of private and federal and consolidated loans they have. And if you're eligible as a candidate and your loans are eligible, then you will get the forgiveness and be notified. The bill also stated that the Secretary of Education would be responsible for notifying everybody with student loans of this opportunity if it becomes available. So that means when they send out their bills to people or the third parties or whoever's under them sending out the bills, they need to attach information about the bill, resources for the person receiving the bill so they can educate themselves, and they need to do that every time. So they don't want anybody slipping through the cracks or not knowing about this, which I don't know how you wouldn't if you have social media or the internet or speak to other people, but just in case, this is an extra step they're taking to make sure everybody knows about this opportunity. Now I just wanted to talk about my thoughts on the bill really quick before I wrap this up. So I probably should have said this in the beginning, but I am a registered nurse in the ICU. I actually work in a COVID-19 designated ICU, which is a medical ICU. I am also a graduate of CRNA school. I just graduated on Saturday, but I haven't taken boards yet because the testing centers have been closed. So I have worked closely with COVID-19 and I'm very up to date on what's going on with it. I think this bill is great. I don't know if it'll get approved or not. I'm not a very political person, so I don't know which way this is gonna go. I would be very grateful if it got approved because it would help a lot of people who are struggling with student loan debt in the healthcare profession. But I also feel like it should be more inclusive of essential workers because I feel like that there's other people that are exposed to COVID-19 that are not direct frontline healthcare workers that also deserve this loan forgiveness and repayment. There are so many people that are working still to make the world go round and make everything keep running smoothly, and even in support of health workers that are not health workers themselves. So that's my thoughts on it. I don't have any student loans myself, so I would say that I'm pretty objective because this bill isn't really going to help me, but it is going to help a lot of my friends and loved ones who do have student loans. And I would be very happy for them if they were able to get this assistance because I know how stressful this can be for them and it's something that weighs on them every day. I think it's great that Maloney introduced this bill and got the topic going and got everybody talking about it. Right now, as of May 6, 2020, this may change by the time you watch this video, the bill is just at the introductory stage, so it has not been passed by anybody in legislature yet, but I will be keeping up to date with what's going on with this bill and I will update you in future videos. And I'm also going to link below the bill so that you can read it yourself and make your own judgments and opinions based off that. And that is it for today's video about the Student Loan Forgiveness for Health Workers Act. I hope that you found this video helpful and informative. I hope that you take the time to read the bill yourself. Like I said, I read it several times and I still feel like I could read it more times because they always word everything so complicated in bills. Let me know in the comments below what your thoughts and feelings are about the bill. I would love to hear your opinion and anything else you have to say about it. And that wraps up this video. So as always, I hope you guys have an amazing week and I will see you next week.